Hello, everybody. Good evening, and welcome to the first 2026 webinar for the 2026 race. This is a medical prep seminar, and I wanted to make sure that I introduce some administrative facts about the seminar before we introduce our speakers here. So first of all, Brock is really pleased to be introducing George Washington Medical Maritime Access Program to our race this year. An incredibly professional group who's going to provide great service to the whole fleet. I wanted to make sure that everyone knows that service is available to every starter in the race and for 30 days. So every yacht that starts will get covered for 30 days after the start of the race. There is a participating vessel agreement. There will be a checklist item on the entry page for the entry manager or PIC. So you have to go in and complete that. Very simple. And that's just an administrative fact that you guys need to take care of. If vessels have their own service from another provider, you're welcome to use that. You do not need to call GW, but you need to sign the participating vessel agreement in case you do call our FCO or our medical service, so that we know we can cover you. I'd now like to introduce our panelists. Dr. Jeff Wish is a board certified hematologist and medical oncologist affiliated with the Dana-Farber Cancer Institute. He's the fleet surgeon for the Cruising Club of America and the medical chair for the Bermuda Race Organizing Committee. And Dr. Adam Rutenberg is board certified in emergency medicine and is an assistant professor in the Department of Emergency Medicine at the George Washington University School of Medicine and Health Science. Dr. Rutenberg manages case review and quality improvement for GW's Maritime Medical Access Program, which provides telemedicine care to seafarers on ships at sea. I'm going to turn it over to Jeff. At any time during the presentation, if you have comments, please put them in the chat. And at the end of the presentation by Jeff and Adam, we'll go through the questions and comments and answer as many as we can. And any other comments you have, please put in there and we'll deal with them at the end. So with that, turn it off to Dr. Wish.
Well, thank you, Andrew, and welcome to GW and everybody, and Dr. Rutenberg as well. We're very excited, as mentioned, to have this relationship, which is new for 2026. I'd like to just underscore a couple of things before we get going, and that is that on the website, I would advise everybody to take a look at the medical advisory services part of the website. It has there the communication and medical protocols manual, the recommended equipment, which we'll hear more about, and the action checklist for the persons in charge. And as I was reviewing for this particular presentation, it occurred to me that we spend a lot of time choosing watch captains, skippers, navigators, and we probably don't give enough time to the importance of the designated medical officer, which you're going to hear more about very shortly. That person is going to be critical to the success of any medical injury or emergency offshore, because it's going to be the person that communicates, as you will hear, with the GW team. And as such, I would encourage, for one, that the crew member who was a designated medical officer be identified as such in the crew locker, so we know who they are. And also, that person should really take considerable time to understand how we communicate, the protocols, understanding what's in the medical kit, and how to use it, as well as having access to the intake forms, which you'll also hear about, so that we can identify medical histories in persons should they come to that. I will tell you just very quickly that we've had incidents in the past where it was only because the medical kit was quite complete that people did as well as they did, and otherwise would have been a much more serious problem. So with that, let me introduce Dr. Adam Rutenberg. We have worked together for the past year and a half, and I'm going to let him take it from here and talk you through GW's resources and how he will interact with crew members and the designated medical officer. So, Dr. Rutenberg.
All right, thanks, Dr. Wish. So I've got some slides. I'm just going to have them just wait a moment here so we can get them pulled up. But I'm going to just talk a little bit about myself, a little bit about George Washington and GW Maritime Medical Access and what we do. There we go. Okay, so let me just start with just a little introduction to myself. So I'm a board certified emergency physician. I'm a staff physician at George Washington University Hospital. And our practice actually also has contracts with the VA and the Defense Health Agency. So I do clinical time as well at the Washington, D.C. VA Medical Center, as well as Walter Reed National Military Medical Center in Bethesda, which is right up the road from George Washington University. I'm an assistant professor at GW School of Medicine and Health Sciences, as was mentioned before. And I also do quite a bit of telemedicine. So I'm not the only doctor with GW Maritime Medical Access, and I'll sort of describe how we function, but I will say that all of the doctors that work and take calls for GWMMA are practicing emergency physicians. So we work in the emergency department, and then on days when we're not in the ER, we are taking maritime call. I am the QI director for Maritime Medical Access, so I do case review and after action reviews and work with some of our clients to improve medical protocols. And then also I'm a sailor. So I grew up in Pennsylvania. I spent my summers in Maryland, where I live now, sailing sunfish and flying Scots and whatnot on the Chesapeake Bay. And then through my 20s and 30s had, before medical school, had the opportunity to spend some time at sea on tall ships. Most of our docks, some were in the Navy, some were in the Coast Guard, some are recreational sailors like myself, but most of us have some connection to, or have had some sea time. So who are we? So GW Maritime Medical Access. So we are a group based at George Washington University in the Department of Emergency Medicine. We were started in 1989 with one doctor who actually is still here. He has moved on and is not doing maritime anymore. He actually eventually became the dean of the medical school for a number of years and stepped back. And now he's, one of our senior faculty members. It started with just him and a pager for about 8 hours a day, and it's grown over the years. Now we have a dedicated call center and a full subset of our ER doctors, and we provide 24/7 medical advice to vessels, aircraft, and remote locations around the world. We are still called Maritime Medical Access, but over the years have discovered that a lot of what we do is really applicable to things like private aviation or remote research stations. And so we provide a similar service really anywhere where people don't have immediate access to physicians or healthcare. All of our docs are board certified. They practice in an academic medical center and teach, as I said. We have about 60 ER doctors, and a subset of about 15 of us basically take the primary and secondary call for this service. So when we are taking maritime call, we're not divided amongst other obligations. We have clients in pretty much every sector of the maritime industry. So shipping, fishing boats, research vessels, and we back up some cruise lines. So some of our clients will actually have doctors on board, and we'll do physician-to-physician consultation. And then like yours, recreational boats, and we have some government contracts and remote location research stations that we cover. So we provide primarily medical support, but also some logistical and operational support for our clients. And then what are we connected to? So George Washington University, we are an academic emergency medical center, or an academic medical center with a level 1 trauma center and emergency department. We're in the heart of Washington, D.C. We're about 7 blocks from the White House. The academic department was the 7th academic emergency department in the United States, founded in the early 80s. So it was sort of on the cutting edge when emergency medicine became a dedicated specialty. We have a section within our Department of Emergency Medicine that we call Innovative Practice, and that's where our telemedicine programs live. In addition to maritime, we have a number of other telemedicine programs and also sort of specialty programs for which we contract and come up with custom solutions for our clients. We also support the second largest EMS agency in DC, and we do a lot of event medicine locally. So in addition to the telemedicine worldwide and the work that we do in our emergency departments, we send our physicians, EMTs, and staff out to marches that you see on the National Mall. We staff stadiums in the DC area. So we're really pretty heavily entrenched in sort of medical operational work in the Washington, D.C. area. And then we are a large multi-specialty practice. So the Department of Emergency Medicine lives within the George Washington University Medical Faculty Associates, which is our physician group. And we have over 50 medical specialties and subspecialties, which means that as we do when we practice in the ER, if we find that we need assistance from a specialist, a colleague, for example, in orthopedics or dermatology or psychiatry, et cetera, we have the ability to get those folks to help us out with really complicated cases. In practice, that's rare. We find that as emergency physicians, we are really sort of well suited to handle most of the things that we might be called for service for. So why am I here? Well, the reason I'm here is that at some point, you all are going to be out here. And, what do you have out there? You don't have much, right? So you have yourselves, you have whatever equipment you have. You may have a physician or somebody else with some medical training on board. But no matter what, no matter who you are, there always may be questions that come up or issues for which you need support. So just a brief outline. I'm going to go over today, talking a little bit about preparation for being out at sea. I'm going to talk about telemedicine at sea, what it is and how it works. And then I'm very briefly going to touch upon medicines and equipment to have, and there's going to be more to come around that. So let's start with voyage preparation. So a couple of important points. Really, the best way to use our service is to not have to use our service. And the best way to not have to use our service is really make sure that you and everybody that is on board your boat is really fit to be where they are. We always have to remember that being out offshore on a relatively small boat or even a large boat, it's a pretty austere environment. There's a lot that can go on. You've got sort of a residential living working environment, close quarters. You've got a lot of specialized hazards. You have weather hazards. Obviously, you can have rough seas. You can have, in addition to environmental hazards, you have potentially mechanical hazards, chemical hazards. So, there's a lot going on. And you really want to make sure that you're appropriately set to be out there. So everyone, before they go, should really make an appointment with their doctor. Discuss the nature of the voyage. Make sure your doctor knows where you're going to be and what you're doing. Make sure that you get a complete physical and that you are up to snuff to be doing the work that you're doing. The work that you're doing offshore. Make sure you're up to date on vaccines. You've gotten your routine lab work, and I always recommend that people get an EKG as well. Sometimes things will come up on an EKG that maybe wouldn't necessarily be expected, that might need some further workup. You want to make sure that you're in good cardiac health. Make sure that your doctor does a medication reconciliation. So what that means is your doctor goes over all of the medications that you're on and make sure that you are on appropriate doses, that you're on the medicines that you should be on, and that you're not on any medicines that you don't necessarily need to be on. And then make sure that you've got adequate refills for all of your time at sea. And then this is important. Everybody has these things come up. Get that rash, that lump, or that other nagging issue checked out. If you're having knee pain, if you're having a weird bleeding lesion on your back, the time to get that checked out is now, before you go offshore, because it never fails. If you don't get it checked out, that's when it sort of blows up and becomes a big issue when you're offshore. And then the other thing is, don't neglect your dentist and don't neglect any specialists that you see. So if you are, if you have a medical condition for which you're regularly, maybe it's annual or even every other year, seeing a specialist, make sure that you make an appointment with that specialist to talk about your condition. And then the other thing is that we do actually see a lot of dental issues. It sort of never fails. The crown, the bridge, it's going to fail. The filling's going to come out. So just make sure your dental work is up to date. If you're having dental pain, that's another thing that you really want to get checked out before you go offshore. And then in preparation for the voyage, everyone should really have a medical summary on board. Anyone on board should have some sort of a summary that's easily accessible to everyone else on board. That doesn't necessarily mean that you have to share all of your personal health information with everyone else who's on board. Generally, what we recommend is that you have a laminated single sheet in a sealed envelope somewhere, and all of these envelopes should be together and everyone should know where they are. The reason for this is that we think of ourselves sort of the way you would think of any other doctor's office. And when you have an issue or a case with us, you're going to be talking to a doctor or emailing with a doctor or somehow communicating with a doctor. And we're going to ask you all the same questions that they always ask you whenever you fill out a form at any new doctor's office. Name, date of birth, what are your medical problems, what surgeries have you had, what medicines are you on, what allergies do you have, if you have a copy of that EKG, and then critically the names and contact information for your own physicians at home, because if we need to contact them, we'd like to be able to have that information. Of course, we won't do that without anybody's permission, and often doctors' offices will require some sort of a release to be signed in any case. But really the point of this is that this information should be available somewhere. Sometimes people ask if they should just keep it as an electronic form. You absolutely can, but we still always recommend that there is a paper copy somewhere that is accessible in case the technology fails or somebody has to fiddle with a laptop or a password or whatever. We want to make sure that this is readily available. And keep in mind that, in a worst case scenario, you may not be conscious, or you may have an issue that doesn't really allow you to communicate this information at the point when it's actually needed. And that's why it's so important that it be collected in advance and available on board. All right. I talked a little bit about this, medications and medical equipment. Just make sure that you've got enough quantity. I already discussed. Make sure things are not going to expire while you're offshore. Make sure that any medications are stored in waterproof containers. Any equipment has been recently inspected and tested. Make sure that you have extra batteries. So if you are going to carry, things like an otoscope or an electronic thermometer, you want to have that. It's worth thinking about if you want to have any specific backup equipment. And the other thing for those that, either wear glasses or have other medical equipment that they might need to manage, having some sort of, extra glasses or extra backup. So great example, if anybody's going with diabetes and they use continuous glucose monitor or an insulin pump, they absolutely should have backup equipment in case any of those fail and they need to start manually checking sugars or dosing insulin. Very important. So other points for voyage preparation. So satellite connectivity. In this case, I know it's a requirement for all of the boats participating to have satellite connectivity, but I just want to make the point again that everyone on board should know how to use the equipment and should know how to communicate. And that comes down to also making sure that phone numbers are readily available and printed somewhere. Any equipment that requires a password to get into or a code to get into the iPhone, make sure everyone on board either knows it or knows where it is, because the last thing you want is for the person who has that information to be hurt or injured and unable to communicate that information, and then you're stuck because you can't communicate. Think about courses and training. Think about who you've got on board. I know that multiple people will have first aid classes during this race. There are a number of first aid classes that can be taken. A lot of people will probably have EMT or paramedic. There may be people who are RNs or MDs, but really more than one person aboard should have medical training. And the other point that I want to make is that, not everyone with the same training even is necessarily going to know all of the same information. So, I, as an emergency physician, sometimes I'm consulting colleagues in other specialties in the emergency department when I think it's appropriate or have a complicated case. And then one thing to consider is that even amongst physicians, even though we all sort of start in the same place with medical school, we all go do residencies and fellowships, and we specialize, and in some cases become highly subspecialized. And this is no offense to anyone on here who might be a doctor, but if somebody has a broken ankle, your psychiatrist is probably not going to be that helpful. The flip side of that is that if somebody's depressed and they're having suicidal ideation, your orthopedist is probably not going to be that helpful. So even if you have a doctor on board, don't just assume that person can handle any issue. Think about, under what circumstances you're going to reach out for help. So also in preparation, just something that, I like to emphasize and have been asked to emphasize as well, is just thinking about a culture of safety on board. So this starts with preparation. It starts with knowing who's on board. And it really starts with everyone understanding that taking care of oneself is really akin to taking care of your crew. And if you're not taking care of yourself, number one, you're putting yourself at risk, but number two, you're putting your crew at risk. Because if you get hurt or injured, you can't help sail the boat. You can't help manage another problem that might come up. But in addition to that, somebody else who's caring for you then has to, pull their resources off of whatever else they may be doing, whether it's watch standing or communicating or, doing routine maintenance. And so really it's important for everyone to stay as healthy as they can. So that means everyone sleep, everyone eat, everyone hydrate, listen to your body. The average adult needs, no matter what they say, needs 7 to 9 hours of sleep. Sometimes us doctors like to say we're great on 3, 4, 5 hours, but it's not really true. And then I do want to mention this concept of a WACL, window of circadian low. So no matter how much sleep you get, no matter how you set up your watch standing, pretty much between the hours of like 3 and 6 in the morning, everyone is at basically their worst, even if you've been up for several nights previously. And so this is a time to really be cognizant about what your thought processes are and how you think about things. This term actually kind of comes from aviation, and there's a lot of good evidence to show that a lot more mistakes get made in that time frame, no matter how you've tried to set up your circadian rhythm. Hydration, really critically important. Listen to your body. Anybody who basically has an intact thirst mechanism and functioning kidneys really should get thirsty when they need water and should take in salt when they need salt. The average adult needs anywhere from 2.7 to 3.7 liters of water per day. It's also important to not just be drinking straight water. You're sweating, you're losing a lot of salt. Sometimes there are issues with seasickness. You may have diarrhea or vomiting, and you lose electrolytes that way too. So it's important to mix in some electrolyte-rich fluids from time to time, some glucose, or just make sure that you're eating. You can drink water as long as you're eating appropriately and eating meals. You can drink water, but if you're having seasickness and you're having trouble eating, you really should make sure to supplement your water with something else, with some electrolyte. Seasickness is always an issue. It doesn't matter how many times you've been at sea or, how hardy you think you are. It hits all of us at some point. It can be minor, but, it certainly can lead to pretty significant nausea and vomiting that can be very difficult to handle. So, prevention, I think probably people have heard this before, but, things like staying topside, making sure that basically what you see with your eyes matches what your inner ear feels. So keeping your eyes on the horizon, not looking down and reading. If you start to feel seasick, look away, try to get ahead of it. The other thing is that if you're prone to seasickness and you're going to take a medication where you start to feel seasick, it's really best to get ahead of the seasickness early, get a little something in your stomach, take a medication if you've got it. A small point about medications, all of the seasickness medications that are out there are not without side effects. They are generally safe to use, but there are some pretty significant side effects that we do see from time to time, and it's really important to use them as directed and not start combining or taking extra doses. If you have an issue, you can always call us and we can sort of talk you through it. We will combine seasickness medications, but we really want to make sure that we're talking about it and monitoring you closely if that's the case. Eye protection, very important. Make sure that you're wearing sunglasses with UVA and UVB protection. If you're going to be doing something that requires specific eye protection, make sure you're wearing the right kind of eye protection. We actually do see a lot of eye injuries in our practice, in our maritime practice. And often it's, somebody's working on an engine or somebody is, working on the plumbing or, otherwise working with some other chemical or solvent, and people don't think about it, and they're just not wearing the appropriate glasses. So, if you're going to put yourself in a situation where you're doing physical work, stop, take the time to go get those safety glasses, make sure you have them on board, make sure you have polycarbonate lenses for that kind of work, make sure that you have splash-proof lab type goggles if you're going to be working with chemicals. Just a quick moment for prevention can really save a lot of time and strife if you have an eye injury. And of course, when we think about evacuations, it's really life, limb, and sight. And that sight doesn't get thought of enough, but really have to protect. I don't know if anyone's going to be welding Probably not on one of these small boats, but I do always just like to put it out there that if anyone's welding, make sure you have appropriate protection and the bystanders have protection. Anyone that wears glasses should have extra lenses with them in case their glasses get damaged or lost. And then contact lenses. So contact lenses can be a little controversial. There's really nothing wrong with wearing contact lenses. Just one thing to be aware of is that contact lenses do put the wearer at slightly increased risks for certain types of infections on the surface of the eye. So make sure that you're appropriately disposing your disposables, you're appropriately cleaning your non-disposable contact lenses. And also keep in mind that if you are a contact lens wearer and you do get something splashed in the eye, you really need to take the contact lens out, flush the eye, and then potentially wash or most likely dispose of or stop using the lens. I already mentioned dental care. Just remember you've only got a limited number of teeth, so make sure you brush, floss, keep dental hygiene up when you're offshore. Make sure you get checked out before you go out. And the other thing is wear sunblock. We're all prone to skin cancer. I have known people who have ignored this and avoided this and had metastatic skin cancer. It is on the rise and it is largely preventable, so something to think about. I want to change gears a little bit now and talk a little about telemedicine. So really, as I said, the goal on board is for everybody to sort of be taking care of themselves, taking care of your shipmates. But things do happen. People get infections, people get illnesses, people get injuries, and it's not necessarily due to carelessness. No matter what happens, there's always the possibility, something will happen. So telemedicine, what is it? It's really just remote medical consultation. And there are a lot of types of telemedicine. And I think since the COVID pandemic, we've all sort of become a lot more comfortable with telemedicine because it's happening so much more. Something as simple as you go and get an x-ray, the pictures get sent to a radiologist. You probably never even think about this. The radiologist, reads the x-ray, it sends it back to your doctor. That's telemedicine. The telemedicine we're all probably most familiar with is getting on a video call with, our physician, but even just calling the office back and talking something over on the phone, that's a form of telemedicine as well. The whole point of this is to bring expertise to wherever you are, to bring, a thought process around the issue that you're having to the location where you are so we can help you to treat those injuries and illnesses on board. I say it's wherever you are with a slight asterisk because there are some licensing limitations. So within the US, a physician really has to be licensed in the state where the patient is located. So as a physician in Washington, D.C., I have medical licenses in Washington, D.C., as well as the adjacent states, Maryland and Virginia. But then as a maritime physician, I also have medical licenses in Washington State and Texas and California and New York. So, and across our maritime practice, amongst all of our maritime doctors, we basically have medical licenses in just about all of the coastal states. It's not an issue if you're offshore, and generally speaking, it's not thought of as an issue if you're in a foreign nation. Generally speaking, countries are not going to enforce a requirement that a foreign physician be licensed if they're taking care of someone from their home country remotely. But there is a limitation there. So what happens when you call us? So I'm going to talk about the flow in a minute and sort of how we work, but what I want you to know from this slide is that we have a 24/7 call center, which is located in our office. It's in our office down the street from the ER. And it's basically a communications and operations hub for all of our maritime medical access services. It's staffed 24/7 by EMTs and paramedics. Those are not the people who are going to be giving you medical advice. It's going to be us as the physicians, but they help us with the intake. They help us to manage information. So we have basically a HIPAA compliant EMR, electronic health record. And then we also have an operational database that we open and track our cases in. We track the locations of ships that we cover. And those communication specialists help us to, get information from you and manage information about what resources might be available to you. And then they also help us to document so that we can create a medical record for you if you need to contact us. So what happens if you contact us? You're going to initiate a consultation with us. Usually that's going to be over phone or email. There are other ways to connect with us. We generally try to say that we're communication agnostic. So once you open a case with us, if we need to, let's say, talk to you over WhatsApp, we can, or over, we have one client that only has a Garmin InReach. We certainly like when people have wideband so that we can, wideband internet so that we can have more robust communication. But when you initiate a consultation with us, the communication center is going to collect some information from you about what's going on, who's injured. This is where that summary that I mentioned is going to come in to play. And then they're going to either pull the physician onto the line to talk, or else they're going to forward the information to a physician. Physician might have some follow-up questions. So if we're consulting by email, usually you'll get a response within about an hour. We might ask some follow-up questions. We keep your medication lists on file, and we're going to make a treatment plan and review it with you. And then you basically are going to put that treatment plan into effect. It might be take this analgesic, rest your, elevate the ankle. Here's how we're going to splint this. Maybe we need to talk you through putting in sutures. It can be whatever the issue is. But it doesn't stop there. So we're going to set a follow-up plan, and then we're going to reach back out to you. Usually we're going to reach out 24 hours later, and then depending on how things are going, we'll continue to reach out anywhere in the 24 to 72 hour range until we close up the case. Basically, a case is closed upon stabilization or resolution of the medical issue or upon shoreside care. So one thing we all have to recognize is that sometimes your ability to manage an illness or injury might exceed the resources that you have on board. And if that's the case, we may recommend an evacuation or diversion. There is also a possibility that we may recommend a specialty consultation, and although that's rare, that could happen. We have an internal policy that anytime we're going to talk about an evacuation or a diversion, we bring a second physician into the case. And in practice, it's usually a conference between, anywhere from 3 to 5 of our doctors. And we really want to talk through the case and make sure that, if we're going to divert you, we are doing so appropriately and we've exhausted other options. And then, there are options for some integrated case management. As far as evacuations go, so, one thing that I just want to point out is that evacuations really you have about a 200-mile limit, a 200-mile offshore limit for a helicopter evacuation with the U.S. Coast Guard. So you all at some point are going to be outside of that range. Now, that doesn't mean that there aren't other resources that can potentially be used. And in certain cases, we may recommend that you contact the Coast Guard regardless, because the Coast Guard is going to know if they have assets in the area. They're going to know if the Navy has assets in the area. We have had people evacuated to Navy vessels before. The other thing is there's going to be a lot of commercial traffic out there. And even though, it may be far away, sometimes you may be better off potentially being evacuated to, another ship that's out there, a commercial vessel, a cargo ship, that might have resources available that you don't. We will never contact the Coast Guard without asking you first. Generally speaking, it's a recommendation that we would make, but we recognize the skipper on each boat really has the final say and the final responsibility for both all medical care on board, as well as connecting with and communicating with the Coast Guard. But we're also happy to contact Coast Guard duty station on your behalf if you would like. And we're also happy to communicate with the Coast Guard and have an open line of communication after you have communicated with them, especially if they're considering an evacuation. The final no-go decision for evacuation is always made by the Coast Guard. It's not made by us, but we will talk to their flight surgeons, and we will also, speak with your shoreside, operations during the race as well, so that everyone's kept in the loop. What we won't do without your permission is share your personal health information with someone who doesn't need to know. Obviously, if we're connecting with a flight surgeon, we may need to, with the Coast Guard, we may need to share some of that information, but we would, this is something we would discuss with you. So when should you call us? We have a simple philosophy. It's call early, call often. We like to say that no issue is too small. So really, I think that there are a lot of situations where you need to call, right? If somebody, falls and they have an obviously deformed ankle or something along those lines, of course, call us. But what if somebody's just a little unwell? What if they're a little nauseous? Maybe they threw up once. Does the issue make you nervous? Is there something about it that just doesn't quite fit? Maybe this person get seasick a lot. They're having their baseline symptoms, but something's a little different. Or maybe they have migraines and they know they have migraines, but they say, I have this headache and something's just a little different. And I'm not really sure. Or do you just need confirmation of your course? You know, maybe someone has a wound. You think you know what to do. You want to clean the wound out. You want to close it up. And sometimes what we do is we just talk through it and say, your plan is great. We support that plan. And, you know, we'll follow up with you in 48 hours and just make sure everything's going okay. But really, here's the important point. So we want you to call us here before you get to that second arrow. So, you know, if you're 100, 200 miles offshore, 50 miles offshore, and you're not sure about something, just call and ask. You know, we'd much rather, you know, take that call with a minor issue than, you know, risk a major issue when you're, you know, 600 miles from anywhere. All right, what else do I need to know? So we have a communications and medical protocols manual. This will be shared with you all. It's about 100 pages, and it doesn't provide information about how to treat an injury or illness. That's not our goal. You know, we don't want to give you a book and just tell you, here's what you do. The goal of this here is to help you to communicate with us. So it's broken down into sections that'll explain how to do certain procedures we might, you know, need you to do. But most of it is going to have assessment protocols. So it's going to give you a sense, if there's time, of what we're going to ask you about a particular injury or illness. There is a quick reference guide in there, which I do recommend that you print out. So this will be digital. You can print the whole thing out in a binder, but I do recommend you put the quick reference out, put it in a, you know, either laminated or put in a waterproof sleeve. This might also be where you want to write the, you know, your satellite phone numbers down so that everyone has it available. And then I want to talk to you a little bit about medicines and equipment. So we've sort of put together a list of medications and equipment for you all. So this will be available for you. It sort of breaks down the recommended medications into various categories. You know, some of the important ones are, a lot of it is over the counter, analgesics, cough and cold medicines, GI medicines. We do recommend that everyone keep a robust, you know, supply of antibiotics on board. And then, you know, there's diagnostic equipment and other first aid equipment that we recommend. Now, again, most of the stuff is really over the counter. You can go to your local drugstore, or you can go on Amazon or any number of websites and buy a kit. Some of these things are prescription. Now, I will say there is no one size fits all approach to stocking medications. And the reality is that if you have a boat of all 25-year-olds, you may need a different stock of medications than if you have people on board who are over 65. And so it is broken down by, you know, highly recommended prescription items. There are some items in blue that should be considered based on specific disease risk factors and also the composition of the crew, and that will sort of all be explained. Now, people do often ask, you know, where can I get prescription medications? And unfortunately, it is a problem, right? You can't just walk into the CVS and, you know, pick up all of these antibiotics. In years past, most physicians, family physicians often didn't have qualms about writing prescriptions for, you know, just in case medications. But unfortunately, you know, the way licensing laws work now and, you know, state medical boards, a lot of physicians, especially newer physicians, are a lot more skittish about just writing medications. So, you know, what I recommend is the first thing to do is to see if your pharmacist will, or it's not your pharmacist, but your physician will write you a prescription for the medication you need. And this is a legitimate use to have, you know, these medications with you. But if not, there are actually services. One of the ones that we work with pretty extensively is called Lafferty's EMS, which is a pharmacy which caters to the maritime industry, which can ship medications under the right circumstances. And we've provided contact information. And there are some other services out there too that are available. If this is an issue for anyone, we can certainly talk more about that. So that takes me to the end of my slides. I know that it seems like there were a lot of comments put up while I was talking, but I, you know, didn't have an opportunity to really look at those, you know, as I was talking. But I'm happy to take any questions. You know, if Andrew or Kate wants to mediate.
Sure. Thanks, Dr. Udenberg. That was a really, really nice overview. I was following the chat, and I know Kate was posting a couple of answers that were easy answers because they're covered already on the website. But I'll throw a couple at you that that either I had or popped up in the chat, and I encouraged Dr. Wish to do the same. A question about the DMO, the designated medical officer. Is the purpose of that designation more about preparation, or is the expectation that the designated medical officer is the one who's going to be handling any onboard issues? In other words, are you expecting the call from the DMO, or can anyone call you in an issue?
So anyone can call us if there's an issue. We recommend that somebody ultimately kind of takes final responsibility for decision making. So we think about that. In the commercial world, it's usually a medical officer. But we recommend that there's someone on board who takes responsibility for medical preparation, who is aware of any calls being made. So in other words, the DMO really should be taking responsibility, but certainly can delegate the responsibility to call.
Got it. I think that's helpful.
Yeah. And if I could just add to that, the other thing that I think is very important in the preparatory perspective is you really need to know what's in that kit, right? So that person really needs to be aware of how that kit was supplied and what's in it, and presumably how to use a lot of those things to help expedite Dr. Rutenberg's work.
Yeah.
Great. Thank you for that. There was a question about, are the return crew covered? I think it was answered in the chat, but for those who didn't see that answer, yes, the vessel is covered from the moment it crosses, starts the race for 30 days. It's not crew specific. So you can have an entirely different return crew. And as long as that vessel is a vessel that started the race, they're covered for that 30 days. A related question was, can I extend coverage? Can I set up a follow-on contract with GW? And I'm sure GW is very happy to do that. In fact, they provided a link and some rates and a special offer for racers to continue coverage post the race. And that's all on our website, along with some promotional pricing. And there's some phone numbers, not the emergency number, some regular phone numbers to call and set that up. So those are those questions. Someone asked, do we still have a relationship with Mass General? We don't. Barbara Master provided the service for many, many years in cooperation with Dr. Wish. She's stepping away from that service, and that's why we're engaging GW, and we're looking forward to having a long relationship with the GW going forward. Question about med kits, and you sort of covered it briefly, Dr. Rittenberg. How does a crew get these prescriptions for the boat? You mentioned a particular service that you're aware of. Was that shared with us, and is it in that med kit list document so that we could reach out to them?
It is. I believe it is in there with the contact information. And if that was overlooked and it's not in there, then we can make sure to share that with you.
That's great. Another question was, are there any new or recommended seasickness drugs that you find particularly effective, or anything that's new on the market?
Okay, so that's a really interesting question. I'm wondering if that happened to come from a doctor, because there actually was a new class. As a doctor, this is probably the most interesting question to me, but also I might have the least to say about it. There was a new class, a new product. The brand name is Nereus. That has a novel mechanism of action for motion sickness related vomiting. It's called Tradipitant, I think is the name. I have not personally prescribed it yet. It was approved in December by the FDA, and I don't think it's actually available yet, but it will be soon. I'm sure we'll be adding that to our repertoire, but that's actually a really interesting question. And I'm actually starting today. I've got a 2-week, I teach medical students, and there's a 2-week advanced pharmacology lecture. And one of the sort of cases that I give them actually is about how we as doctors sort of stay on top of new drugs coming out and how we integrate them into our practice. And so that's a very timely question, because there is this new medication that was just prescribed or approved rather, but probably not going to be available for us yet.
Got it. That's great.
One other thing on that I just want to add, and that is one, there's an article on our website about seasickness that I actually wrote, which is still pertinent. But the one thing also that people ask about is what meds are the best, and it's basically the ones that work for you. But the one thing I would suggest and that was alluded to is that try out the meds before you go offshore, because the side effects that Dr. Rutenberg talked about can be quite significant. And you'd like to know that you are sensitive to that or not. And the other thing I'll just mention is that this is not something to be macho about. So even if you're slightly prone to it, some folks will start these meds 24 hours ahead of time. And again, I would refer people to the article that's online on the CCA website.
And I'm just going to add to that too, and this is mentioned in the medication list. There are medications for seasickness that are not necessarily approved in the United States. That doesn't necessarily mean you can't use them. I can't put them on my list, and I can't come out here and say that I endorse them necessarily. But if you have a medication like Stugeron, for example, that it's on the boat and you call and you talk about it, that doesn't mean we won't necessarily use it. So just want people to be aware of that.
That's great. There was a related question about Zofran for severe seasickness. What's your comments about the use of Zofran?
So Zofran is not shown to help with nausea and vomiting associated with seasickness as a first-line medication. That said, I think it's still one of the most important medications to have on board. Next to antibiotics and perhaps an EpiPen, it's probably the most important and possibly the most used medication on board, because people do still get a lot of gastroenteritis. And the fact that the data, doesn't show that it helps with seasickness necessarily doesn't mean we won't use it or consider combining it with an antihistamine if need be.
Great. There's a good question about communications Kate Summers. Thank you, Kate, for being the person in the background, making sure we're all on track and popping those comments onto the screen. What about the use of Starlink or other broadband comms? Does that help you at all?
It does, but I will say it only helps us in certain situations. And I'll explain why. I think that oftentimes people get really caught up in the technology. So people are so focused on wanting to get on video, and so they start worrying about antennas and computers and cameras, and does my microphone work? And really, if we're just trying to gather information, and 90, I'm sure Dr. Wish might say the same thing, that 90% of medicine is in the history and the physical, and we can get a lot of history just talking on the phone or over an email, and we can actually get a lot of physical talking on the phone or even over an email. One of the things that we do is work with lay people, and so we will describe how to get sort of an analog of a physical exam finding that we're looking for. That said, sometimes video is indispensable, and if you have that capability, sometimes we will recommend a video call if there are certain types of exam findings we want to look for. But it's not by any means necessary, and strangely, sometimes it actually detracts from the interaction.
Great, good advice. Didn't come up in this chat, but it came up earlier in conversations I had with a couple of teams. What about the use of WhatsApp? We have a lot of boats from overseas that don't have US data plans, and maybe using Starlink is great for bandwidth, but they want to use WhatsApp as their phone service. And I'm asking you, and I already know the answer, because I know that one of the backup numbers that your Kate told us about is WhatsApp available. And I just wanted to make sure that everybody knew that that number is also on the contact sheet. So if you want to use a WhatsApp account to communicate, GW can answer that.
Yeah, we can. We prefer not to use it as a first line, but we can use it if need be.
Great. I think, unless either of you saw other comments that I didn't catch, or unless either of you have other questions or comments you want to highlight, I think we're pretty much covered.
Andrew, just one last thing. This came up with discussion with a crew that I had recently, and that is, the question came up, do I need to worry about COVID anymore? And of course, this was a big topic of conversation years past. And the fact of the matter is, unfortunately, it's still out there. And I think you'll see in the medication list that Paxlovid in the appropriate setting is still recommended, as well as taking a kit with you. And I would just suggest, because we've had this happen in the past, that if you are ill with any symptoms as such prior to going offshore, please test yourself so you don't bring that along with you, because it can still be quite debilitating.
Yeah, I think, we still see plenty of COVID. Thankfully, it's not the same COVID that we were seeing in 2020 and 2021 and 2022, but you don't want a bad flu either. And COVID is definitely still prevalent. One of the differences between COVID and flu is that it has a much higher attack rate. So, it's very likely that if one person on a small boat has COVID, everyone on the small boat is going to get COVID. And, the severity is quite variable. But if there are people that are, high risk for complication, it's worth having Paxlovid on board. Any other questions?
I want to thank you both, Dr. Wish, Dr. Rittenberg. What a great presentation. I think we covered all the questions that came up in the chat. And I'm really looking forward to this new partnership. I think it's going to be terrific for the fleet, and I hope you don't get any calls.
So do I, but we're looking forward to working with you as well.
Very good. All right. And thanks to Kate in the background, much appreciated. And to the audience out there, thank you. We'll see you on the next webinar, which I think is coming up later this month.
Thank you.
All right. Take care.
May 4th on the Gulf Stream. That will be our next webinar.
Great. Thanks, Kate.